I'm Dr. Aubrey Capen, and I'm going to answer the most Googled dental questions. Dental hygiene is so important. So your daily habits really form your lifestyle, right? So every day, brushing and flossing is vital. I say brushing twice a day, flossing once a day. You've all heard this spiel, but we all make our own decisions on how we want that to flow into our daily routine. Picking a dentist is so important. It's so much more than just someone that's gonna come in, look in your mouth, say a bunch of numbers and words that sound like Morse code. You want someone that can connect with you. You want someone that's gonna educate you and explain not only the conditions in your mouth, but how your overall health affects your mouth and how your mouth affects your overall health. They work together hand in hand, and it's so important to feel comfortable. Your dental hygienist and your dentist, your dental team should not judge you, and they should be there for you. We're your biggest advocates. Picking a dentist is so important to understand the training that they've been through. In our office, Dr. Connelly and I are both general dentists, but he's actually went through more advanced training where he offers IV sedation and implants. We pride ourselves in keeping procedures here in our office. We have the latest technology, so we can take high-tech advanced dental x-rays to clinically diagnose things, and then we have digital scanners which help us to do same-day restorations. Also with patient education, we have intraoral cameras, so you can actually see what we see through those crazy magnified dental loops to better show you, concerns that we have in your mouth, and it's really amazing. So you want to look into that dental office before you just commit to going to seeing them every 3, 4, 6 months, depending on your recare regimen that they recommend for you. And like I said, it's just all about feeling comfortable in that space with your doctor.
Are dental x-rays dangerous?
Okay. Such a commonly asked question. Did you know that when we take a CBCT, which is our 3D dental x-ray, it's actually exposing you to less radiation than eating a banana from the supermarket or taking a long phone call with your mom on your iPhone? On a weekly basis, I have patients in the hygiene department that will say, nope, I don't want dental x-rays today. And I kind of joke at first. I'm like, okay, let's get out my magic 8-ball and let's see what procedures we need to do to help, you and your mouth. Oh, today it's going to be a root canal. Oh, tomorrow it's going to be a crown. Without dental x-rays, we can't properly diagnose things that we can't see, between the teeth, within the root of the tooth. We have to see that, anatomy and see any disease state. So dental x-rays are not dangerous if you are willing to chat on your cell phone, willing to eat a banana, maybe fly on a plane to the West Coast or the East Coast. Radiation is all around us, and now with advanced technology, it's been greatly minimized and you are highly protected.
What is periodontal disease?
Okay, periodontal disease is often referred to as gum disease. Typically, you'll hear terms like gingivitis. That's inflammation of the gums, okay? With better oral hygiene and routine visits to the dentist, we can clean you up and really reverse that inflammation. With periodontal disease, it goes much further. The tartar and plaque buildup on your teeth has hardened, and it started to move down the roots of your teeth, causing bone loss. Bone loss in our jaw is irreversible, so we can't go back, but we can stabilize things. We can eliminate the plaque, we can eliminate the inflammation, and really restore health and function within your mouth. But that typically requires recare of every 3 to 4 months within our office, seeing our hygiene team, making sure that you are healthy. So there's different levels to cleaning. Everybody says, oh, I'm just going to the dentist for a cleaning. So you have your traditional adult prophylaxis, and then we have a gingivitis prophylaxis, which is where if a patient has gingivitis, they have inflammation of the gums, it's going to be a little bit more of an advanced cleaning. You'll come back and we'll assess that inflammation has in fact decreased. And then there's also periodontal maintenance. So if you've already been diagnosed with periodontal disease, maybe that disease has been cleaned up and you're on a maintenance. So we're trying to keep your bone and your tissue nice and healthy and stable. And then there's also what's called scaling and root planing. So that's typically that tartar has built up on the teeth and is below the gum tissue. So we'll actually get you numb for that. and then you won't feel it when the hygienist goes in to remove that hardened plaque and tartar from the root surfaces of your teeth. After you've had a procedure like that, again, we bring you back and we reassess how is everything healing. Think of it as a procedure, as a surgery here that we're doing to improve your health. And then from there, we can determine if you need to be seen every 3 months or every 4 months. Every body is different, truly. The host response is such a big factor in these cases. There's many signs and symptoms that you may have periodontal disease. If every time you're flossing and brushing, you're seeing a lot of blood, maybe when you smile really big, you see your gums are very red and irritated, or they're just sore. Those would be signs where we'd want you to give us a call so that we could take those x-rays and assess what's below the soft tissue, below the gum tissue, to see if you do in fact have bone loss or if you do have calculus, which is that hard tartar buildup.
Should I try teeth whitening?
Okay, teeth whitening is so controversial. So everybody wants a nice bright white smile, but sometimes people's teeth are more sensitive than others. For me, teeth whitening is a no-go. I can't use the Crest Pro White strips, but I know they work fantastic for so many patients. I'm a big advocate for whitening toothpaste and whitening mouth rinse. I think that it does work wonders, and I always tell my patients anything that could stain a white t-shirt can also stain your teeth. So do you need mouthwash? You know, if you're brushing and you're flossing and you're rinsing out your mouth and everything feels fresh, I say maybe not. But if you feel like you're brushing, you're flossing, you still feel like you have bad breath, you know, are you brushing your tongue? Are you tongue scraping? Are you removing as much bacteria that you possibly can from your mouth? Well, then maybe it's trying mouthwash. I feel like really it depends on the person, it depends on the patient. You have to make that call for yourself, and we can work together to talk through your routine and what's working for you and maybe what's not working for you. So mouthwash is not to be used to replace traditional brushing and flossing. Certainly it can be added to your routine and you can use it throughout the day to maybe refreshen and rejuvenate yourself, but definitely don't skip the traditional brushing and flossing.
How often should I floss?
Floss, 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 floss. How many times a day should you do it? I say at least once a day. I like to floss at the end of the day after I've enjoyed a full day of eating and drinking my favorite foods and beverages. It just helps to get me ready for the night and, you know, going to bed fresh. But a lot of people love flossers. They love floss picks. So maybe you're driving in the car and you're like, I need to, you know, get in there, or I'm bored and this is my opportunity to floss. Fantastic. Again, kind of like the mouthwash, I say add it into your routine with the flossers and the floss picks. But if you can get in there with traditional floss, really C-shaping around each tooth and all of your gums, that's your best bet at avoiding cavities and just keeping your mouth fresh. Dental care recommended for seniors is really the same as it is for everyone else. We want to see our senior patients. For them, I would say, you know, maybe they have older fillings, older crowns, root canals, things that are starting to break down and deteriorate. We definitely want to be checking those restorations, you know, just as often as anyone else, and making sure that we can help to restore that. And if you have a loved one where you have noticed that maybe their breath does smell, or maybe they're accumulating a lot of plaque or food and debris between their teeth, it could be because their dexterity is, you know, declining and they need some extra assistance. So by all means, you know, be proactive and get that loved one in to see us. And if there's things that you can do at home to help them, I would highly recommend that. For my older patients, I love doing the water flosser, especially, you know, in those back regions where it's really hard to reach with your toothbrush or, you know, traditional floss. They can slide that water flosser in and it can kind of penetrate the water through all of their teeth and just help to keep them nice and clean.
What causes or can cause sensitive teeth?
Sensitivity really varies. Are you guys catching a theme here? Every single person and every single tooth is different. Welcome to my world. Sometimes I feel like I'm Nancy Drew. And I would say that with sensitivity, if you have a history of braces, a lot of times when those brackets are adhered to your teeth and then removed, it can be a little bit sensitive after that, right? Because that's having some dental treatment. Maybe you've had some fillings done. That can cause a little bit of sensitivity at first. It should definitely diminish, but I say for patients that have had more dental work done, it's likely that they have more sensitivity. If you are whitening every day, every week, that hydrogen peroxide and sitting on your teeth can really weaken the enamel. So that in itself can definitely cause sensitivity. Every patient has a different thickness of enamel, so that outer structure of your tooth, and then the dentin is that second layer, and then the third layer within the tooth where the nerve lies is called the pulp. So when you're born, if your enamel is thinner than, say, someone else's, it can definitely cause heightened sensitivity. And I do see that in a lot of my patients. That's actually where the discrepancy between everyone's coloration of their teeth comes from. So if you have a friend that maybe their teeth look a little darker than another friend, it's likely because, the layers of their teeth are different and their enamel may be a little bit thinner, showing that dentin, which is more of a yellowish hue. I'm Dr. Capen. Don't forget to like and subscribe. If you have more questions, drop those in the comments. And if you're looking for a new dentist and you're in the middle of the mitten, as I say, come find us at St. John's Dental Care. Go ahead and click the link to check out our website and book your next visit.